So, Brooke, I want to turn to you. Darvin mentioned mentorship, trainings, a lot of things that he's experienced at SSM Health. Can you tell us a little bit more about the mentorships, the trainings, any kind of upskilling that SSM provides to its international nurses?
As Darwin and Diana both mentioned, these nurses will all be going through our nurse residency program, which is about a year-long program with various classes taught by Darwin and Diana, as well as our other nurse residency specialist. And something I should mention is each of our ministries have a nurse residency specialist or two, depending on the size of the ministry. So our larger ministries will have two, just to ensure that they're able to touch base with everyone. And so while you're in this year-long course and going through your orientation, these nurse residency specialists will be checking in with you to make sure that everything is going smoothly, you're progressing to coming off orientation, to make sure that there's no issues with like the preceptor. Sometimes personalities just don't match up and we want you to be successful. And so pairing you with somebody else might be the right step or the right option to do at that time. And that's kind of all driven by the nurse residency specialist. We've also identified a gap with some of our internationally educated nurses in not having as much experience with electronic health records. And so we've added in an additional EPIC training for all of our internationally educated nurses that they will take prior to going on the floor. So before they're in a patient setting, they can really be comfortable with the charting and the different systems that we use on the computer. And then lastly, I would say something that's been recently added is our HealthStream platform. And so in the US, we do a lot of online learning and continuous education, a lot of yearly criteria or metrics that have to be met through that. And so this health stream is for our new graduate nurses and our internationally educated nurses. And it really allows us to develop a very personalized plan for you. And it kind of guides you through different scenarios and you kind of do it at 3 months, 6 months, 9 months, and it really allows us to tailor your education to ensure that you're getting what you need from us before you're on your own.